Brad Cook. I'm the head of the international department, and I've been running the international department now for 13 years, dealing mainly with foreigners who live in Costa Rica or tourists coming to Costa Rica. And I've been running all the coordination of services for those patients in the hospital, coordinating with doctors, hotels, everything related to that. Also with all the insurance, people coming with insurance from all over the world. And Clínica Bíblica Hospital has been around since 1929, so we've been around for quite a while, almost 80 years, and it's a nonprofit, world-class medical institution. So really, we don't need medical tourism, but we've been very interested in seeing what's happening, and our hospital is starting really to focus on that, and is even planning on building another hospital in the next few years as well. I would say that our care is probably as good, if not better, than most of those countries. We hear that over and over from our patients. Some of our health care indicators that we've compared to statistics in the U.S. are better in most areas. So I think in that sense, we're just about to have JCI accreditation this month in December. We're hoping to get that, so that gives a little bit more security to patients coming. So I think that's really not a concern. I think it was just a logical step. I can't say the hospital did that for medical tourism, but just looking, we want to be, our mission is to be the best private hospital in Costa Rica, and that was really just the next step. And we looked at several other accreditations and decided that that was the one the hospital wanted to pursue. And one of the great advantages of Costa Rica, first, is location, 2.5 hours from Miami, 3.5 from Houston, and it's very close. But Costa Rica is just an unbelievable destination for tourism, ecotourism. So there's all kinds of things for people to do, from volcanoes to whitewater rafting to beaches. So really, in that sense, the family has a lot to do, and people generally do take advantage of that. We have the Joint Commission International Accreditation in Central America, at least. I'm pretty sure. We're very well known. We have the latest and best technology. The hospital's invested a lot, and I think, in fact, a lot of other countries in the region send their patients to us in cases like that, as well as insurance companies. Cruise ships always look for Clínica Bíblica Hospital. So I think definitely quality, the type of physicians we have, the standards. To be a doctor, Clínica Bíblica is not easy, so we really get the cream of the crop. In Costa Rica, I think it's the tip of the iceberg. There's so much potential. My fear is that we're not going to have the facilities to handle all the patients that are going to eventually come to Costa Rica, but I definitely think it's not a fad. I think this is going to explode. You hear it over and over and over again, and it makes perfect sense if healthcare is not affordable in the U.S., and there's countries close by that are, and the quality of care is just as good. So I think we're just beginning.